Hello, everyone. This is Dr. George Gonzalez, the founder of Quantum Neurology, the author of the Holographic Healing Series. Today, we are welcoming a guest, Dr. Jen Hartley from Colorado, and she's going to be speaking at our event, our homecoming event, November 11th and 12th of 2016. And her topic will be trauma and injury recovery care plan protocols. And the description of her class will be this lecture will cover how to assess and strategize recovery care plans for trauma and injury. The intention is to help the practitioner gain the confidence in knowing how to evaluate, as well as start, proceed, and finalize a care plan for these tougher and more multidimensional health and recovery issues. We will cover 3 types of trauma: physical, musculoskeletal, organ, and allergy immune. Thank you so much, Jen Hartley, for being here, and welcome.
Thank you, George. I am so excited to be here with you today, and I'm thrilled to be at the upcoming seminar. This is going to be the 3rd time I've talked at this particular seminar, and every single time I come, I walk away with the most amazing world of knowledge from other practitioners, and I'm also honored to be able to provide a little bit of information for them about things that I've discovered that essentially make our recovery modules easier for patients. So I actually got so excited about this particular talk that I contacted a number of different quantum neurology doctors just to find out, well, what would be the thing that they would want to hear of the most? Because I really wanted to present something that would create incredible value on what they can do differently in their practice the minute that they get home. And from that, I concocted that for the most part, what happens is when somebody comes in with a shoulder injury, a foot injury, or, they've got one little issue, you know exactly where to go. You know the first thing to start with, the first cranial nerve to look at, you know exactly where to go with that. So you're like, all right, let's go ahead and get started. But when somebody comes in that's either in a severe reaction where they literally look like or feel like they're completely breaking down, or they come in and their history is very vast, where they've got an entire list of like 17 different things that they need to have fixed, or it's a very major issue, like a major injury. What happens with most doctors is they're just like, shit, like, what am I going to do here? Like, where do I even begin, and what do I do next? So for me, when I write down protocols of approach, it really helps me recognize that I don't have to know anything, because every patient that comes in is going to have a totally different experience, a totally different story, but I can just back up and go, okay, let's just start with the protocol. Because if you just start with the protocol and you enter everything in, pretty soon you find you're at the end of the protocol and you didn't know what to do from the beginning, but the patient ended up with incredible recovery. So that's the number one thing I wanted to do. I have a professional snowboarder who, I live in Denver, Colorado, and I've been practicing here for about 10 years. So I get the fortune of being able to go up to the mountains all the time. We snowboard and ski all winter long. We do a lot of rock climbing in the summer. And this is also kind of the epicenter of the people that do that are the best of the best of the best. So I get the great opportunity of running into these people, whether it's on the mountain or, hanging out and having a beer at the end of the day. So I got the good fortune of meeting this woman who was a professional snowboarder. She was on that gear, and then she became a professional snowboard instructor. So she's the woman who actually teaches and instructs the Olympic snowboarders. So she, in my opinion, is the best of the best. So she's the one that makes the professionals. So in the middle of one of her sessions, she took a nice little digger after hucking off a cliff and ended up basically completely haloed in the hospital. I'll tell the story a little bit more during during our event. And she was very young at the time. She had just turned 30, or she was just about to turn 30. And essentially everybody was telling her that her career was over, that she would never do athletics again. She would certainly never snowboard again. And so at the age of 30, she's having to reconstruct, like, what am I going to do, who I am? And she almost couldn't get out of bed for about 9 months. So of course, I didn't get her when she was in that position, but I did get her recently after, where she was in the situation where she's not just emotionally devastated because her career and her livelihood her passion has been taken away from her, but she's physiologically devastated at the same time, to the degree that she could barely get through a yoga class, which was the number one thing she was using for recovery. So I looked at her, and she had, this entire host of things that had occurred, including a hangman's fracture of C1,
Wow.
which that she was lucky just to get off the mountain, right?
Wow.
So when I was looking at doing her recovery, I recognized hangman's fracture of C1 is clearly going to be a whole lot of cranial nerve stuff. But that wasn't even what she was complaining about. What she was primarily complaining about was the inability to have strength in her core and to use her arms and use her legs. And she was also, because of all of the pharmaceuticals that she had been inundated with at that point of emergency, she had developed an entire leaky gut syndrome where her intestines weren't even absorbing food. So by the time I met her, she was like 85, 88 pounds.
Wow.
And was literally just coasting away to nothing. So you're like, well, where do I even begin with that case?
Well,
so
before you go on, the reason she was able to survive that level of injury was because of her athleticism.
Absolutely.
Absolutely, no doubt.
Yeah.
And we could see how quickly the nervous system declines. What period of time? You said 9 months?
Well, no, she was in bed for 9 months.
Right.
I got her at the point of recovery where it was almost exactly 3 years to the day of the neck injury, but she was not yet like fully functional athletically. She was starting to self-rehab through yoga, essentially, is what she had gotten to, the point she had gotten to.
So it's amazing, even with the wonderful exercising that she was doing to rehabilitate. And this is what happened to me personally. When I got injured, there's a level of injury that you almost have to relearn everything, relearning how to walk, relearning how to balance, relearn how to move, relearn how to do everything. And people are at a loss when that happens, because they're like trying to do things the way that they used to do them. Instead of going, oh, I have to retrain these patterns, and just like an infant does, and that's what I had to go through, and retrain the musculature and through its movement, and retrain the balance of the body in all different positions. And these are things that only people like athletes that know how to train originally could do in some cases. And she was able to do it to some degree, but obviously not to the level that she needed.
Yeah, so she's just been a very rewarding person to work with, and she's now my number one rock climbing instructor. So we took her I'm actually her rock climbing instructor. We instruct each other, we push each other. We went rock climbing 2 days ago, and we were being belayed from the ground, and we were going up some granite cliffs here in Clear Creek Canyon, which is above Golden in Denver. And we were each about 10 feet-ish off the ground, and we had another 30 or 40 feet up the rock wall to go. And I looked at her and I was like, so you want to race?
Oh.
Yep. So we raced up the granite cliffs, and I've only been working with her now for about 9 months.
Wow, amazing.
So get that concept, to get somebody from, I can barely functionally do yoga and I'm wasting away to nothing, to the point that now I tease her about being fat because she's actually gaining muscle, and she's athletically racing, competing again at some level, is just an amazing experience for me to have the opportunity to participate in. Plus, I'm now going to get some good snowboarding training, and I have a really fantastic rock climbing instructor to boot. So add
myself to that list too, the snowboarding instruction and everything.
Yeah. We're getting her. Our goal is to get her back on the mountain this year, even though her rehab doctor told her she will never snowboard again. And that's what I also love, about this rehabilitation protocol, is it's when you're rehabilitating somebody from this, and not just this, like it could have been somebody had an auto accident or a fall that, put them out of, a job where they couldn't sit for long periods of time, or, something that's not necessarily as extreme as like a snowboarding instructor. There is a mental shift then that now occurs with these people. And it was the cranial nerve protocol that really got that mental shift to start changing, where she was like, I can do this. Like, I am not a failure. I am not a waste of skin anymore, which was what her physiological experience was. She was like, if I can't snowboard, my life is a waste. And now it's like, okay, well, we may not get her back on the mountain at that capacity ever again. But she's now starting to rep for snowboarding companies, and she's like starting to engage back in the field. And
Right.
all of that occurred with the cranial nerves.
I
So it
love
was
it.
physiological recovery. It was, how do I engage back in the world? So that's what I'm the most excited about. And that's the part of the presentation that is the physical, musculoskeletal trauma and injury recovery. But I also had one of my colleagues say that they were very interested in learning about how I had done an allergy immune trauma. And it had started.
Before we get to that, could I just comment on what you just said real quick?
Yes.
You know, I want people to understand that the exercises you're using to rehabilitate your patient, the rock climbing and those kind of things, what I found rock climbing to be extremely beneficial and in personal rehabilitation, and I'm using it on my Lyme patient as well, especially if you're using rope climbing inside of a gym. You know, you have them. If they fall, you know, they're not going to hurt themselves. And they get to challenge themselves in a way with their whole body, holographically. It's really empowering in many ways, in many levels. So it's not only an elite athletic performer like the snowboarder that could utilize that kind of holographic training. It's very powerful to do. It's empowering. I've seen it, what it's done for my daughter and her confidence of getting up a 40-foot wall, and it's wow. I love it. I love it all the way around. I think it's wonderful. So sorry, I didn't mean to interrupt you, but I wanted to.
No, I completely agree. Even for myself, I think rock climbing was one of the hardest and most challenging sports that I ever participated in because of the holographism. I'm very good at compartmentalizing, right? Like, oh, I can do this in this capacity and then shut that down and do this and this capacity. And I think the reason rock climbing was so incredibly rewarding when I finally got it, but incredibly challenging, is it may just have been the first thing that I'd ever participated in where I could play at my maximum capacity holographically without the fear of being injured.
And do it very short bursts too. Like at a rock climbing gym, you're doing a 16-foot wall, which, you know, when you're doing it, it might feel forever, but it's only, you know, max of 30 seconds to a minute. And I can do anything for a minute, and then you sit and rest, and you watch everybody else, and you learn. And it's an amazing experience to do, and, you know, to crash onto a 2-foot pad, at least in the gym that I go to, and not hurt yourself and go, oh, okay, well, I could challenge myself a little more than I would on a real rock face or something like that. And then to get into the rope climbing side, which I just started, that's a whole nother level, and the mind game of it, and all while being secure. That's the power.
Totally of it. Secure. Yep. Yeah. So, okay. So one of my colleagues, I had this experience a number of years ago about, I am an incredibly sensitive person when it comes to anything that is, like an anaphylactic type allergy. Yes. So just overly responsive to anything. Like I've had to do extreme maneuvers to make sure that there's only essential oils in all of my household products. And that's good in general for us all to have anyway, but there's a difference in between somebody that overly responds to that, where it's just like almost like ridiculous, and someone who knows that it's good for you, so they don't do it. So one of my things is I am also a beekeeper, and I have an anaphylactic reaction for bees. And I'm a beekeeper. So I ended up actually after, because every once in a while you just make a mistake and something happens. And I ended up in some level of like extreme or anaphylactic response or reaction to a bee sting. And then there's another story I'm going to tell about something else that I went into an anaphylactic response with. And we used the holographic rehabilitation to completely get me out of that anaphylactic experience very, very quickly. So it's lucky for me that I'm a quantum neurologist, because most people, it's like I'm anaphylactic now and their doctor has an appointment at, 4:00 on Thursday to see them. But with those individuals, I've had individuals come in that are not necessarily an anaphylactic, I'm going to call it like immune response rather than the allergic response. They're not necessarily anaphylactic, but they're still severely debilitated. I had a patient that came in who had just moved. It was her first springtime in her new house. And then all of a sudden, this monstrous, gorgeous tree in her front yard goes into bloom, and she's in the emergency room. So
Wow.
she had that much of an allergic reaction to whatever was being put off by this tree. And we did the holographic rehabilitation allergy response, and within a day or less. I mean, it wasn't by the end of the visit. By the end of the visit, she was feeling a little bit better. But I think I got an email by the end of the day or the next morning saying that she was off all of the prednisone and she was breathing again and she was able to go to work by the following day. So it's just amazing how quick the recovery can be when you know how to approach the body in the right way. And then, of course, it's not as extreme, but it's still just as fun when you're using that experience for more day-to-day things. Like I have a woman who was just miserable every time she went to work because whatever was going on in her work environment was causing an allergy. So I had her collect a sample of her work environment. We just made her non-allergic to work and the experience is completely different. And then I have another gentleman who wanted to get a dog. He really wanted to get a dog and he's crazy allergic to dogs. His wife wants a dog, his kids want a dog, and he's the one that's limiting this experience. So we did the same protocol on dogs, and within a month they had a dog and he's fine. So
that's amazing. It's a wonderful experience, and you know, having personally experienced these kind of things through this work and this concept of making the nervous system congruent with its surroundings, you know, and just looking at it through that perspective is making the nervous system congruent with its surroundings, making sure it's congruent with whatever these kind of stimuli may be, whether it's, you know, the dog or otherwise. Once we make the nervous system congruent, there's a higher tolerance of being able to be in that presence. And that's been our experience by doing this work, and it's fast, it's very effective apparently from all the experience that we've had with it. You yourself with the bee sting, you even have a tattoo of a bee on your arm, which I think
I do, yes. I got my homeopathic tattoo, and it has not happened since.
Wow.
So I always say, I'm not sure if it was the quantum neurology, the homeopathic tattoo, but something worked there.
I think the bees think you're one of them.
Yes. And then, so that is the allergy immune trauma protocol that I'm going to go through. And that also lends into using the exact same protocol holographically to help people be non-allergic to self.
Right, absolutely.
Rheumatoid arthritis and multiple sclerosis and stuff like that. So that's not necessarily a trauma, but once you know how to do that, it's a very easy jump to do the next, which is, of course, life transformational for people that are dealing with autoimmune issues. And then the final thing was organ trauma. So I got this idea because I had started working with a gentleman who had had a surgery for his pancreas, and they nicked, I don't know what it's called. I need to find out what that whole bed of nerves that basically cascades down into the intestines. There's a certain name for that curtain of nerves, but they had nicked that entire curtain of nerves. So his pancreas was fine. He had actually gone in because he had a little tumor on his pancreas. Tumors removed, pancreas fine, no sign of cancer, but now his entire intestines don't work. Wow. And they had nicked that curtain of nerves, and they were like, well, all we can do is just kind of hope that it comes back. We'll see what the body can do. So we started working on, well, let's assume that we're still within a field where we can, you know, holographically rehabilitate whatever is going on there in the miscommunication that was traumatically caused, this time by surgery. And that's still a work in progress. So I'm excited to see what the end result of that is going to be by the time homecoming starts in November, because we're about, I'm going to say, halfway through that protocol. But we have started to have, even within his first couple of visits, he was being bag fed. And so you can tell how much the stomach and the intestines is absorbing by how much goes in versus how much comes out of the entire bag system. And he went from having less than 1% absorption to 30% absorption of the nutrition within one visit.
Great improvement.
Yeah.
Great improvement.
So we're about halfway through with his protocol, and that's the final thing that I'll present on during the trauma recovery. So I'm just super excited to be asked to be there. I'm very thrilled to be learning from all of these amazing doctors, and I'm just incredibly honored also to be able to participate and see what I can teach others.
Thank you so much. And the reason we invite you back is because everybody loves you and everybody loves what you share, and you inspire people with the success that you've had with quantum neurology and the patterns of success that you're sharing with everybody, and then they're seeing the results as well. And one thing that I've shared with other doctors, it's such a gift to be able to do this work and then to share it with others and to have them receive the gift of healing and watching others heal and being able to witness that firsthand. And now I've shared it firsthand with you, and now you're sharing that same concept with other doctors as well, and you're seeing the knowledge that you've organized through these concepts being shared to doctors, and they're starting to duplicate it and get success with what you're teaching. It's very powerful. And thank you so much for being part of the quantum neurology family. And if somebody wants to come see you as a patient, or if they want more information from you, how do they do that? Absolutely.
I am right off I-25, right in downtown Denver, Colorado. So my office phone number is 720-524-3477. And we're at 2757 Bryant Street, downtown Denver, Colorado. And I would love to see anybody.
And what's your email? Or
it's Dr. Jen Hartley at mac.com. So DrJenHartley at mac.com. And my website is drjenhartley.com.
Awesome. And if you're interested in coming to our November event, it's November 11th and 12th, 2016. We would love to see you there. This is our first event that we're inviting the public to. Any doctor, all your staff, your family, your friends, your spouse, please come and learn about quantum neurology, learn about what we're presenting to advanced healing in our communities. Thank you so much, Jen, and I look forward to seeing you soon.
Thank you.
Bye, everyone.